Yep, we're doing a prone therapeutic massage routine.
Contact, hold, and focus.
Okay.
Open the shoulder and entire arm with Swedish strokes, remembering to work centripedically whenever possible, especially with lighter, more fluid movement techniques. Limit your use of lubricant at this time.
So centripetal means everything going towards the heart. And I'm not really using any pressure, it's just really just the weight of my hand. Okay.
After warming up the tissue, use traction to lengthen, opening the shoulder, encouraging them to go south and relax. Try clasping the hand instead of the wrist for comfort.
Yep, and see what I have is the thumb and holding into the palmar surface. I'm pulling just enough. There you go.
Thumb the thin lines down the metacarpals, ending with traction on each finger.
So that's where you do that little kind of pincher like thing all the way down. Then you come all the way out to the fingers and you do a little rotation and a pulling of the fingers. Okay.
Stretch the palmar fascia, spreading the tissues between the thumbs and pinky finger.
All right.
Work the range of motion of each finger and thumb. Pinch and squeeze the webbing between the fingers.
Okay, now that's one of those areas where I eliminate some of the steps because when I was doing the seam lines, as I did the pull out, you notice that I rotated. So that's where I saved time at, by making that all one move. Now, when they talk about the webbing, they're talking about here and the spaces between each of the metacarpals. Like so. Okay.
Work the palm and fist muscles, running the thumb or finger between each metacarpal space. Visualize stretching the palmar interossae, spending more time on any crunchies you find with circular motions using alternating thumbs.
Okay, I don't feel anything in here, but if there was, I would kind of work on that little area with my thumbs like so. But I don't feel anything in there. Okay.
Perform an Indian rub of the retinaculum of the wrist, then stabilizing the arm by holding the thumb. Open the forearm flexor muscles with the heel of the hand.
Okay, now y'all remember the Indian kind of burn thing? Not really Indian burn because you got a little bit of lubricant on your hand, but it's to help loosen up that retinaculum because at times when people have numbness in their fingers and stuff, sometimes it's the retinaculum is so tight on the nerves and so forth that it'll get that sensation as well. Then you said open up the forearm flexors. Push okay, Mia? Okay.
Work the flexor compartment with deeper tools with your focus on separating each muscle from the wrist to the elbow.
Okay, deeper tools, 3 fingers. You can do 6, but you know, it's still a small area, so I wouldn't recommend it. And you can do thumbs. All right.
Pay attention to the attachment sites of the elbow. There are both flexor and extensor attachment sites on both sides, as well as the biceps attachments. Using your thumbs, a single thumb or forefinger, use your whole hand to knead the tissue.
Okay. So I'm kind of doing like a petrissage motion because my hand is on both sides of it. And so I'm working both the part around the forearm and I'm moving up to around the epicondyle area as well. All right.
Address the triceps brachii from the olecranon to the glenohumeral joint, starting with the heel of the hand, repeating with deeper tools. The triceps' most superior attachment is between the teres major and minor. Do not overlook the axillary region.
Okay, so your triceps run right here. Try because there's 3 of them there. All right.
Work the posterior and medial head of the deltoid using 3 fingers and thumbs. Perform a pin and stretch maneuver if needed.
Okay, so the posterior deltoid is here, and then the medial part is here. Now, the way to do a pin and stretch in this area, see, I would also pin and stretch the tricep as well. And you can do that by simply now, as far as the deltoid is concerned, to do a pin and stretch there, place your thumb right there at the deltoid tuberosity. Okay, Mia? Okay.
Address the trapezius muscle using deeper techniques, like 3 to 6 fingers, pin and stretch from the acromion process to the nuchal ligament and back, adjusting your stance as needed.
Okay, now they're saying go from the coracoid, which is from here, and going inwards. But, you know, like I was telling y'all, the way that they have that stuff written up, it doesn't really go with the flow, because if I was doing the work, I would work my way up, take care of the back, then go into the hand. So my strokes would technically, because the way we do the trapezius, my strokes would come out this way. And then I would go into the arm and sit. But if you're working on somebody who has a single-sided problem, then you can do it. Because not everybody gets a full therapeutic session. Most of the time people get therapeutic work applied to whatever's bothering them. Okay.
Close with general Swedish strokes. Make nice after all that deep work, and finish with a contact hold.
And that's it. Make nice. Do some joint manipulation. Shovel some snow. Elephant swing. Or swim.